Hi, this is Dr. Dave with Triad Health Center. I wanted to take a few minutes to answer another frequently asked question, that many of our patients ask us, and that is care in your office covered by insurance? The short answer to this is no, but the why we don't is much more important to understand. Simply put, insurance companies dictate the reimbursement rates and the duration of your care based on problems that they deem relevant. Insurance tells you what doctor you can use, in which network, and who you must see. Also, what most people don't realize is that your insurance company decides how you are to be treated and what medication you're allowed to be prescribed. And the bizarre point here is that you are a customer of the insurance company. So what are you paying for? For them to dictate your care? Have they ever met you? Do they sit down with you and do an in-depth health history, listen to your needs and health goals? No. Yet Americans pay into this model of healthcare, allowing our insurance company to determine the treatment we receive. Do you realize that's what insurance in America does? Most people don't even realize this. Insurance is taking away your right to see who you choose for healthcare services, and yet you still write them a check every single month, blindly paying into their system for years upon years. Unfortunately, the intention of the insurance company rarely has anything to do with your health or how to fix the cause of your health problem appropriately. And instead, it is really about the bottom line and increasing profit for the insurance company. Unfortunately, this is a losing situation for you, and we are seeing this now across our country. The rules involving medical records, billing codes, and prior authorizations have gotten more and more complex. So, is our current conventional healthcare model working? No, it's not. We in America, our healthcare system, we're horrible at treating and fixing chronic healthcare issues. For example, in the 80s, you had about a $5 copay. Everything was covered. And then in the 90s, it was a $25 copay. Then in the 2000s, it went up to a $35 copay, and then maybe a $50 copay. And now we're seeing even higher copays than ever. $80, $100, $150. So everything is going up. Cost of healthcare is going up. Copays are going up. Premiums are going up. Deductibles are going up. Everything is going up except health and wellness. Why is that? Do we believe that today our medicines are better than ever before? Yes. Are our procedures better than ever? Yes. But these only work with symptom-driven, emergency, crisis care. And when you apply symptom-driven procedures to every health issue, it doesn't work. We're horrible at treating chronic health conditions in America. But don't get me wrong, if I have a broken bone or my appendix burst today, please, by all means, get me to the emergency room. Get me into the hospital for an acute issue like that, or a heart attack. That's what the model is here for. But if I'm experiencing something chronic like fatigues, headaches and pains, depression, cholesterol issues, diabetes, hypertension, or obesity, we're horrible at treating these chronic conditions. And if you look at any statistic anywhere, every decade we're worse than ever in treating these chronic healthcare conditions. Let's take obesity, for example. In America, over 70% of us are obese or overweight. 70%. That's creating a new average in our society, which is just bizarre in itself. That creating a new average is actually becoming accepted. And we weren't designed to be obese. And that's why we keep following the conventional model of healthcare, diet and exercise is what they say. Well, we don't even know what that means without proper education that we're not getting from our doctors. And eventually they give us a pill to take and say, take this for 6 months, then come back for a follow-up. And then at the follow-up, we're still overweight, we're still obese. So the med must not be working. So here, let's up your dose, let's add a second pill to the mix, and that's it. And that's where our current healthcare system is at managing chronic health conditions. We're really not getting to the root cause, the underlying cause that's causing the disease to develop in the first place. And that's what, just gets to me. And when we apply conventional healthcare and conventional healthcare process to insurance, from a clinic's perspective now, they have to account billing, coding person, auditors, postage. I mean, everything adds up. It's expensive. It's a high overhead cost to the clinic or the hospital just to bill out the visit for the patient that the patient is costing them. And the statistics show this. Around 80% of what's collected is actually going towards billing out the visit itself. So how are they making money? It means getting more people in the doors, which means less time spent with them, maybe seeing a doctor for about 7 to 10 minutes and then walking out the door with a prescription in hand. But what if you're having one of these chronic health issues, weight management, chronic back pain or headaches, hormone issues, digestive or gut issues? These aren't conditions that you can get through with quality healthcare in 7 to 10 minute appointment. There's just no way. To find the underlying cause and design a treatment plan that will get to healing that cause, you need to spend a lot more time with the patient. You need to understand their needs and find that missing puzzle piece. Our goal at Triad Health Center is to be different, to offer something different than the conventional healthcare model that we know is not working. So we said, how do we get different results with our patients if what standard healthcare what they're doing isn't working? We need to do something different to get different results. And it starts with you and addressing not only why you're not feeling well, but what is the reason for that? What is the cause? And working with you on a plan that is goals driven, that has progress checkups, reassessments, mindset support, one-on-one coaching with a team that has you in mind the entire time. We're not answering to an insurance company who wants to cut off your treatments or limit the type of care you can receive. We're truly here to turn over every stone, offer a deep investigation into what is going on and the why, and bring you through a process of healing step by step. The unfortunate reality about today's healthcare is that you have to swim upstream to try to get a good, healthy quality of life. But I'm sharing this so you know you have options. You can choose who your doctor is. You can choose where to go for health answers. So how do we work without insurance? Simply, we offer self-pay rates and plans that are affordable, and we work with you on your monthly budget to make sure you're receiving the best quality of healthcare while keeping it affordable. Most of our patients use our natural healthcare system as their primary source of routine wellness care. And if an emergency crisis arises, they know that conventional medical system is there for them if they do need that. But we're here to support you through that process. We have services that support maintaining your wellness through functional medicine, pediatric wellness, nutrition, corrective chiropractic, and other holistic therapies, as well as customized services for addressing chronic health issues without the use of medications, helping your body finally get to the underlying cause of those chronic issues so your body can heal, like hormone imbalance, chronic headaches, or back pain, ADHD, hypertension, diabetes, or IBS. The main reason our practice offers these self-pay options is to keep our rates affordable to our patients. And so you can get the quality of help that you need at an affordable price, without having to answer to insurance companies. So now we can make recommendations about your health care with you in mind and not what the insurance company is willing to pay for. And our patients, they get the results, and it goes to show for it. The majority of our patients are able to cut their healthcare expenses way down once we start working with them. They actually get to avoid frequent ER or urgent care visits, which immediately saves them money. But in the long term, their quality of life improves. They get sick less often. And even if they do get sick, they can come to us for help in healing, rather than simply running to the hospital or urgent care for a medication or surgery. It's truly a beautiful system that works so well. So I look forward to meeting you in the office and addressing the root cause of your health problem so you can start living a life of abundance and quality. See you soon.